Hi, my name is Caitlin Reedy, and today I'm going to be talking about antibiotic resistance prevention. So before we kind of dive into how antibiotic resistance can be prevented, I think it's important to understand what antibiotic resistance is and kind of a timeline of how it's grown over the past few decades. So Dr. Julian and Dorothy Davies wrote a paper called The Origins and Evolution of Antibiotic Resistance, which kind of detailed the overall background and kind of a timeline of how antibiotics resistance has grown and how there's been an increased prevalence in antibiotic prescribing since the discovery of antibiotics. So just after 1940, you can see in the timeline above, the discovery of penicillinase was the first kind of account of antibiotic resistance that was recorded. And penicillinase is an enzyme that's actually resistant to the common antibiotic penicillin. And I think a lot of us know what penicillin is or have been prescribed penicillin for maybe like strep throat when we were a kid or something like that. So that was kind of the first discovery of antibiotic resistance. And then moving forward, between 1960 and 1970, a period begins that's called the lean years. And we'll talk about this a little bit later, but the lean years was a period of time when there were no new antibiotics being discovered, which caused a significant increase in antibiotic resistance because we're not able to create new methods of treating these pathogens that are resistant to certain antibiotics. So you can see on the right that 1970s, which is kind of in the middle of the lean years, since then, there's been a significant increase in the prevalence of what are called beta-lactamase enzymes, which are a form of antibiotic resistance enzymes. Between 1970 and 2010 was the end of the study. And so this kind of shows that as the prevalence of antibiotics grows, also there's an increase in antibiotic resistance as a whole. And so what causes antibiotic resistance? Well, Dr. Ventola and colleagues wrote a paper called The Antibiotic Resistance Crisis, which kind of reviews what causes antibiotic resistance and some things that we might not think about when we're thinking about antibiotic resistance. So some common things that you might know over the overuse of antibiotics, the misuse of antibiotics, incorrectly prescribing these drugs. And some things that we might not think about are the extensive treatment of livestock in agriculture. And so this occurs when farmers are giving their livestock antibiotics extensively to prevent infection, which is really helpful for the livestock. However, whenever humans consume these animals, they're actually consuming a small amount of antibiotics when they consume them, which just contributes to the spread of antibiotics and the increase of antibiotic resistance. Another thing that I talked about previously is that few new antibiotics are being developed. And so if you look at the figure on the right, it shows the number of antibacterial new drug application approvals. And so you can see there's been a significant decline over time of new antibiotics that are being discovered or approved. And so, like I said before, this is a problem because we're not coming up with new ways to treat these infections that are resistant to antibiotics. And so why does antibiotic resistance prevention matter? So Dr. Telliant and colleagues just did a study where they looked at antibiotic resistance in surgery and cancer patients. And infection is actually one of the most common complications within cancer treatment. And so in this study, they looked at the percent of antibiotic-resistant bacteria that was present within infections post-surgery or chemotherapy-related infections. And it was found that 38.7 to 50.9% of the infections at the surgical site are from antibiotic-resistant bacteria, and 26.8% of chemotherapy-related infections are from antibiotic-resistant bacteria. And you can kind of see that broken up between surgeries in the figure to the right. But you can see how big of a problem this would become, because within post-surgery and cancer treatments, these are already patients who are at risk. And so when they're developing these infections that are resistant to the antibiotics that you're prescribing them, this is an issue, because their bodies can't fight it off, and we can't find medications that are fighting it off. So you can see how this would cause severe complications within this field. So the big question, how can it be prevented? So Dr. M. Haber and colleagues did a study where they looked at antibiotic resistance prevention within hospitals. And their hypothesis was that implementing new infection control methods, limiting the admission rates of patients that have these antibiotic resistance pathogens, switching antibiotics early on, and finding antibiotics that the patient isn't resistant to would be significantly helpful in slowing the spread of antibiotic resistance pathogens within hospitals. So what they found was that actually switching antibiotics early on was one of the most effective ways of treating these pathogens that were resistant to certain types of antibiotics. So you can see in the two graphs to the right of this figure, these show the frequency of colonies with resistant bacteria. And so within, if you're switching the antibiotics within the first 1, 2, even 3 days of infection, it actually prevents the colonies of antibiotics from growing, because if they're resistant to one antibiotic, they may not be resistant to another antibiotic. So this actually showed to be one of the most effective ways to treat antibiotic resistance within hospitals. So the problem within this field is that most people don't actually know what antibiotic resistance is. And so these two papers, or two studies, Dr. Lauren Brooks looked at antibiotic resistance, kind of the outlook of antibiotic resistance within doctors and clinicians. And Dr. A.R. McCullough and his colleagues did a study looking at the outlook of antibiotic resistance as a population, what the population knows, what they believe, things like that. And so it was found that most people actually don't know what antibiotic resistance is, and they don't know the consequences of overusing and misusing antibiotics. And although that many clinicians knew what antibiotic resistance was, they didn't actually believe it was a problem in their practice. So you can see how this would be a problem if doctors are not taking the necessary steps needed to prevent antibiotic resistance.